Hi, my name is Victor Rodriguez from Alternative Consulting. My background includes community organizing, social work, and public health. I weave my experience and background into the work that I do. I'm a first generation Mexican immigrant of indigenous descent, and I've lived here in Washington State most of my life. This short presentation is a part of a series funded by BSK to support grantees during COVID-19. The goal of this presentation is to give you an introduction to concepts and strategies that address COVID-19 through an equity lens. This presentation is intended to reach the broad organizational diversity funded by BSK. For more detailed and tailored information, please contact us. This presentation has two learning outcomes. Number one, how historical and current policies result in the unequal burden of COVID-19. And number two, how organizations can lead with an equity in their response to COVID-19. Here are the elements we use when we say we're applying an equity lens. First, it's a power analysis. At the heart of inequities is the unequal distribution of power and resources. Applying an equity lens means we analyze how power shapes social relationships and access to resources. There are different kinds of power. Institutional power is the interlocking authority government, economic, social, and political institutions have and exercise. Together, they shape the overall direction and conditions of our society, and ultimately, they shape your life significantly. Second piece is historical. Historical and ongoing policies distribute and shape institutional power based on race, gender, and class constructs, among others. For example, slavery or not giving voting rights to women are policies that limited access to institutional power among Black people and women. In the context of COVID-19, those with more institutional power have more protection against COVID-19. For example, they may have jobs with work options that allow them to work from home. They may have health care. They probably have paid sick leave. And those with less institutional power have less protection. For example, they may have jobs that place them at higher risk. They are more likely to suffer chronic disease and be more likely to be living in concentrated living conditions. Another key component of our equity lens is intersectionality. Applying an intersectional lens means we recognize that institutional power shapes lives in complex ways. Some folks embody multiple identities that are oppressed. For example, an undocumented woman is likely to face barriers not just because she's Black, but also because she's undocumented. She likely faces different barriers than Black, educated, and high-income earning counterparts. In the context of COVID-19, it means we account for how people's multiple identities shape their level of protection. For example, we know that older adults are among the most vulnerable and at risk for severe illness, but we also know that an older adult who is also experiencing poverty or is experiencing discrimination or is part of a group who is oppressed will probably face many more barriers in addition to the ones posed by this virus. Finally, resilience. And any time that we apply an equity lens, it's important that not only we recognize the struggles, but we also recognize the resilience that people show when they experience different forms of oppression. It's important to recognize and highlight the resilience and how people have survived and overcome unequal distribution of power. For example, Black, Indigenous, and people of color communities have contributed immensely to creating a more fair and just world. Focusing on resiliency uplifts the strengths, assets, and leadership of the most negatively impacted. And we must learn from past forms of resistance and organizing to build a multi-generational movement for equity and social justice. In fact, it's really resilience that ends up being the most important part in some ways of equity work, because resilience is really about creating the new world and creating alternatives to our current situation. Resilience allows us to move from a place of trauma and experiencing trauma to a place of resurgence and healing. Now let's apply our equity lens. When we are thinking about the impact that COVID-19 is having on the community, we must situate the current situation in a power and historical context. Across the United States, Black, Indigenous, and people of color communities are being disproportionately negatively impacted by COVID-19. We know that structural racism has led to Black, Indigenous, and communities of color with less institutional power and resources, which translates to a less ability to protect themselves from COVID-19. The worst COVID-19 mortality rates among Black and African American communities exist in the southern states, a legacy of slavery, Jim Crow laws, and mass incarceration. The Navajo Nation has the highest per capita COVID-19 cases in the U.S. This too is deeply rooted in a history of attempted genocide, infringement on tribal sovereignty by the U.S. government that have resulted in underfunded health systems and other services. In other words, some of the vulnerabilities we see among Black, Indigenous, and people of color communities are a direct result of a history of structural racism. We see some of the same patterns here in Washington state. We are often viewed as a region whose residents enjoy prosperity and a high quality of life. However, there's a deep and persistent inequities that significantly impact the health and well-being of Black, Indigenous, and people of color. For example, Black, Indigenous, and people of color in Washington state are being disproportionately impacted by COVID-19. In Yakima, for example, farm workers are currently engaged in one of the biggest strikes in our state's labor history, demanding safe and dignified protocols in the workplace to prevent the spread of COVID-19. Healthcare access was already limited and a high barrier for limited English speakers in Washington state, and COVID-19 is only broadening this divide. Our history shapes the present in things like redlining, exclusion of people of color in the GI Bill benefits, mass incarceration of people of color, these are just to name a few, have created conditions that leave Black, Indigenous, and people of color less protected against COVID-19. So what do we do about it? Here are some things your organization can do to address COVID-19 with an equity lens. Many of you were already providing important services to communities experiencing inequities prior to COVID-19. However, the current situation may require that you look at how you provide those services. Here are some tips to help you if you're struggling with where to start. First, assess and learn. Engage with your clients to learn what their needs are during this time. Be mindful and emphasize and realize that for many clients, priorities have shifted to immediate needs like food and rental assistance, childcare, and mental health services, just to name a few. And this may or may not be the kinds of services you already were providing. But from an equity lens, it's important that you step back and look at how your current services are aligned with the needs of the people that you serve. Next, you identify what your existing capacity is to fill your client needs. Again, some of the needs that are arising you may already be positioned to address, some you may not. And so looking and identifying what your capacity is important so you can communicate to your clients the kinds of things they can depend on you for and the kinds of things they'll need to be look other places for. Next is engaging and strategizing with your funders to adapt contracts to fit new needs. We recognize that not all contracts would be able to be shifted, but where you can, engage with funders to talk about how your contracts can be adapted to meet the current needs of the people you serve. And last, research and identify new funding and resources to strengthen and build your capacity to meet the emerging needs of your clients. Many of you also hire and employ people who are part of groups that are experiencing inequities. So here are some things you can do to support your staff. Number one, you can create opportunities for staff to voice their needs and experiences. This can look in many different ways. For example, you could do a healing circle, you could do a gratitude circle, you could do different kinds of icebreakers within your regular meetings to encourage staff to talk about the things that they're experiencing and to process some of those things, which goes to the next piece. Processing what's going on in the community is really important. So seeking out opportunities for staff to process the current situation may help staff deal with stress. It may help staff respond to the clients in better ways. And how can we do this during this time? This is hard times during COVID-19 to be able to do this virtually. And so we recommend that you really lean on the relationships you had previously, and you really make time to connect with folks in various different ways. And then lastly, adapting your services is also a key aspect to supporting the staff and the clients that you serve, which means that you may have to adapt the services you provide. So engaging your staff and how and where to do that can be a good way to leverage the strength of your staff and to include them in some of the changes that are happening in your organization as a result of COVID-19. Here's another thing you could do. Build on the existing resilience that many communities already have. We know that Black, Indigenous, and people of color communities have a deep and rich history of resilience. We know that there are incredible amounts of resilience in these communities that are being impacted by COVID-19. So for example, some of the things that we can learn from the past and past movements of Black, Indigenous, and people of color communities is that things like spirituality, can be a powerful way to support healing, to support resilience, and to sustain the struggle for creating a different world and a better world. And spirituality here is we're using in a very broad uh, way, which can include faith and religion, but it doesn't have to. It could also be the kind of spirituality that comes through deep connection and deep love, or music, or art. Spirituality here really refers to the feeling and experience that one feels when they feel deeply connected to other people or the land. Another thing that we've learned is organizing collective power is an incredible way to build capacity within the community to address the issues that are impacting that community. And lastly, multi-generational. We know that COVID-19 is not going to end anytime soon. Even after we are able to contain the actual virus, we know that the social and economic impacts are going to be felt for many years to come. And so what we've learned from past movements is that, again, connecting youth with elders can be a powerful way to sustain this work across generations. One of the most powerful resources people have is partnerships and relationships. During this time, lean on your most trusted relationships, whether it's at personal level, at the professional level, or at the organizational level. Seek those relationships to find support, guidance, and mutual aid. Create opportunities for leaders in your network to strengthen relationships and to develop a collective analysis of the current problems, of the possible solutions, and the actions that can be taken. And lastly, resist the scarcity mentality. Instead, promote a vision of abundance and collective care. The scarcity mentality undermines genuine relationships and partnerships, which can be particularly dangerous during a time of crisis. Now more than ever, we need to promote a narrative that promotes relationships and a collective approach to the current situation that we're facing. The narrative surrounding COVID-19 matters. We must narrate COVID-19 negative impacts in terms of systems and power and resist the narrative that focuses on individual behaviors. Here are some ways you can shape the narrative. Unpack the reasons why. Understand and voice the connections between desperate COVID-19 impacts and structural racism. Go beyond vulnerable population narratives and focus on distribution of resources and power. Ask critical questions like who benefits? What does the data show? Questions that can spur deeper thought as to how this is impacting the community. And bring in data and evidence, including stories informed by community experience that elevate the life and death questions that are critical to leading with equity. Identify change makers, whether if it's change makers within institutions or change makers within the community. Ensure that decision makers are thinking and talking about COVID-19 in a way that focuses the response and recovery efforts from an equity lens. Who are the decision makers both within institutions and communities? This could also be an opportunity to implement inside and outside strategies to create effective change. Thank you for watching this presentation. For more information, please contact Best Starts for Kids Capacity Building Team or email us. We look forward to hearing from you. Thank you.